Hello, I'm Congressmember Judy Chu from California's 27th Congressional District and also the chair of the Congressional Asian Pacific American Caucus, or what we call CAPAC. I'd especially like to thank the Center for Asian Health Research and Education for the invitation to join this critical discussion. It is a pleasure to participate in this Gastric Cancer Summit, which is bringing together so many healthcare experts and researchers to bring awareness to this often deadly disease. Unfortunately, too many in our communities are unaware of the reality that you, as providers and researchers, see every day, and that is that Asian American and Pacific Islanders, or AAPIs, are especially susceptible to gastric cancer. In fact, AAPIs are the only racial or ethnic group in the U.S. for which cancer is the leading cause of death for both men and women. But despite this elevated risk, AAPIs are generally screened for cancers at lower rates than the majority of Americans. From 2010 to 2014, Asian American men had the highest incidence and mortality from stomach cancer in the U.S. And to this day, Korean Americans have 5 times higher incidence of stomach cancer compared to white Americans. This major disparity in cancer rates is disturbing, but it is unfortunately not unique to stomach cancer. For years, CAPAC has been united in our efforts to increase awareness and funding for hepatitis B vaccines and treatment. This is because while AAPIs make up 7% of the total U.S. population, we account for over 50% of those living with hepatitis B. Like so many AAPIs in the United States, I have lost close friends to this disease. Before coming to Congress, I had the honor of supporting a good friend and longtime community activist, Chi Moy, in his run for city council in the city of San Gabriel, California. When he won, he made history as the first Asian American to ever serve on the San Gabriel City Council, and the community rejoiced in the success of such an excellent leader. But one day in his 40s, Chi tried to donate blood and discovered that he had hepatitis B. 2 years later, it turned into liver cancer. We watched as Chi grew more fragile and as he fought the disease valiantly, hanging on until he was sworn in as the first mayor of Asian descent in the city's history. But just a month later, he died at the age of 53. I shared my friend Chi's story to show how important it is to make sure that those who are susceptible to this disease get tested. But the real tragedy of Chi Moy's story is that it did not have to happen. Hepatitis B is preventable through a vaccine, and it is also treatable. However, because there is so little awareness surrounding this virus, 2/3 of those who have it don't even know they are infected. What's even worse is that many don't become aware of the condition until they develop symptoms of liver cancer or liver disease, and by then, it's often too late. But I know that early detection for AAPIs is just as much of a challenge with gastric cancer. So in Congress, my fellow members of CAPAC and I have made it our mission to raise awareness of this disease and increase funding for testing and vaccines. And I'm proud to say we have begun to make progress. In addition to raising significant awareness of hepatitis, we've increased federal funding by $2 million for a total of $41 million in annual funding for the Center for Disease Control's Division of Viral Hepatitis, which can conduct initiatives like a national vaccine strategy for hepatitis B. And I believe we can do the same with gastric cancer, but there are several concrete steps that need to be taken to get there. First, the number one way to influence funding levels for research and policy is through the annual congressional appropriations process. Each year in the spring, Congress undertakes a massive effort to evaluate the federal budget and see which areas need to be increased, which need to be decreased, and which needs to be added, and what needs to be cut altogether. Each member of Congress then submits their suggestions to the Appropriations Committee, which debates these funding levels and makes a full recommendation to the full House of Representatives. Then the whole House debates and votes on the final funding numbers, and the entire process is repeated in the Senate. It is a long and arduous process with many twists and turns, but it provides many opportunities to make the case for funding specific disease. For hepatitis B, our success came with a coordinated effort within KPAC offices to make the same request for the CDC Division of Viral Hepatitis. So once you, the advocacy community, coalesce around a specific request, it is important to bring it to Congress and to KPAC specifically before this appropriation request period starts, usually in March or April, so that we can coordinate our requests. And then it is up to advocates to meet with offices and urge them to support funding for gastric cancer research. I can tell you that as a member of Congress, I always take seriously requests from constituents to support specific funding proposals. So having advocates, researchers, patients, and doctors meet with their members of Congress is essential. And finally, the best strategy I can recommend here is consistency. Many groups come back year after year after year, making the same request, getting a little more support each time. It can seem disheartening, but as we see with the hepatitis B example, it pays off. So thank you all for participating in this summit. I look forward to working with you to build a coalition around winning the battle against gastric cancer in the United States and eliminating this health disparity for AAPIs all across the country.